Nation? Welcome back to the clinicaltrialsguru.com. We are in LinkedIn event, some first annual event in LinkedIn here in LA. I've got Dr. Burke Alexander, very active on LinkedIn, and a physician. You create a lot of videos?
Yes, I just started to.
Okay, and we'll get into a little bit of that, but first I wanted to ask you, selfishly, as a clinical researcher, one of my jobs is to recruit doctors to do studies. Many are resistant to it. So, what are your thoughts on research? Let's say I approach you and say, hey, Dr. Brooke, you want to open your own clinic? I'll help run all your studies. You just maintain the oversight. You can add extra revenue stream to your practice. What would you tell me? Is that a good pitch?
Yeah, that's a good pitch. And again, I would say it depends on what study it was. Is it medical devices? Is it, PRP? Is it stem cell research?
Let's say I said
is it
family
medication?
medicine, like all kinds. I'll bring asthma, diabetes, COPD, irritable bowel, just, your typical patient clientele.
Well, and like I said, it would depend on, are we using older medications? Are we using brand new medications? Because again, I'm a huge fan of pharmacogenomics and pharmacogenetics.
Okay.
And so, again,
And why are you a fan of that?
Because right now in America we practice chronic disease, and so meaning that we wait till the population or we wait till the patient is sick rather than preventing. And so I want to change and disrupt healthcare and make sure that not only you as a patient, but your entire family, loved ones, or friends don't get sick, and that we have the purview to actually prevent most diseases today as we know it. And 80% of all medications you take in your lifetime are digested or metabolized through the liver. And one simple test, which is a swab of your buccal or your cheek, will tell you all of those drugs which you should not take. Because not only will those drugs possibly cause side effects, but could end in liver failure or kidney failure, coma, and even worse, death.
Is 23andMe a good replacement?
Sorry?
23andMe?
You mean a certain company?
Yeah.
There's multiple companies worldwide. When I first started talking about pharmacogenomics, there was about 3. Company came out of Sweden to talk to the Orange County Osteopathic Medical Association. At the time, I held a position as president. But again, you can pick whichever company you'd like to, whichever company your physician might be working with. The problem we have here in America is just a few short years ago, just recently, the Centers for the Head of Medicare physician stepped in and said, we're not going to do this anymore. And at that point, only about 0.1% of physicians in the United States had actually tested their patients. So that being said, Medicare is now not paying for it. So Medicaid won't pay for it. So many insurers, major ones, dropped out.
So you got to come out of pocket, basically, if you're an educated patient.
Yes.
Because your doctor won't recommend it. Right?
Yeah, well, and unfortunately, the major pharmaceutical players, which are a $1 trillion industry worldwide now, are actually still, even though it's 2 decades old, are still telling physicians that it is a hoax, it doesn't work, that it's not actually useful.
The PGX?
Yes.
Yeah.
And so that's a real problem.
You also talked on stage about about mammograms, right? And I own a CRO. We're doing a lot of breast cancer studies now. I'm just starting to get into oncology, so I'm learning a lot. One of our studies is a breast cancer study, right? We're using immunotherapy. You said something interesting there. The Medicare will only reimburse for mammograms for women 50 and over. Is that right?
Well, Medicare, unless you have a disability like an SSI, SSD, most Medicare recipients are senior citizens. They're going to be 65 and over.
Right.
So what I was saying was the medical associations.
Okay.
So we're looking at the American Cancer Society, the ACS, the Susan G. Komen Foundation, the American College of Obstetrics and Gynecology, American Association of Family Physicians, American College of Internists, and the biggest culprit, and I say culprit because this group is not made up of one specialist. They're all primary care physicians, and they're all usually recent graduates. So they're made up of a group of persons or physicians put together from the basically United States government. They try to say they're not funded, but they are for the United States government. They're called the United States Preventative Task Force Services, and they're looking at a cost-effective ratio to treat the public. But with that being said, they're the ones who started stating you don't need to have a mammogram screening at age 40 for all women in the United States. You can start at age 50 and it can be done every 2 years. Well, the American Cancer Society is the one that puts out the data on breast cancer. So the American College of Radiology, of all the groups that are out there, are the only one that are sticking to their guns, if you will, stating that we will not fall into the trap of all the other groups led by the basically U.S. government of allowing U.S. women to be diagnosed at a stage 3 or 4 or even a 2 at age 50, doing a screening mammogram at 50. Some of the groups have been a little lax and said, well, you can talk to your doctor at 45 if you want to start, but there's a clear recommendation mandated by the United States Preventive Task Force Services to start at 50.
And that's to monetize.
To monetize, yes. But the American College of Radiology says no. They came out with they have a November annual conference in 2017, right after Thanksgiving, and they said, we absolutely will not change our stance. Our recommendation is, as it has been for many years, 40 an annual. Why? ACS, American Cancer Society statistics, were the highest ever. Breast cancer in women aged 40 to 49 were over 36 to 44,000 women.
Wow.
That was the highest ever.
Between ages 40 and 49.
And what they said was, if a third to 2/3 of all doctors in the United States are even no longer recommending a screening mammogram, these are the women who had significant issues, whether they had pain or they felt a lump or bump, or maybe their doctors found one on exam. What are the amount of women that were missing because we're no longer recommending that screening exam at age 40?
So how do we educate women, or just patients in general, about doing the research on their own?
Well, that's what is a wonderful thing. We had our first Masters of LinkedIn Summit here, organized by Dr. Josh Luke.
Yep.
He's a health, wealth, and healthcare futurist and edutainer. And along with his sponsor, Forbes.com, and Josh Blatt, is we can do this through social media. When I was in school, we didn't even have the internet.
Yeah, right.
Started Quincy University, small Franciscan Catholic University in Illinois, in 1992, double majoring in biological sciences and chemistry with a flute scholarship, a concert flautist. So we didn't have that ability. There was no Facebook. I don't think Mark Zuckerberg was alive yet.
But this segues
Maybe he
into
was.
you as a physician using.
Yeah, so what I'm
social
saying is
media.
we didn't have that, but now we do, and it's free.
Mm-hmm.
And we can, with LinkedIn, with over 500 million persons using it, we now have the opportunity to not just stay in the United States, but go out internationally. And
But do you create content straight to patients? Like, is that what you do?
well, not necessarily for patients of mine, but I do this for the public.
Okay.
So I started, and I don't even have time to do this. I do it when I can, but I don't devote very much time to it. But I started with just about 200-300 people. In 2016, about June or July, it's now ballooned to almost 8,000 people, international, and a lot of them are my colleagues, PhDs, MDs, DOs, with that top universities, top research, and top programs around the world.
So you're interested in that?
Yeah. Well, actually, we're staying together. So.
You had I know you had a question.
Oh yeah, just listen to you. It was an honor to listen and be part of this LinkedIn. I just started utilizing the videos. Probably the first question that we'll have is like, what do you have in your mind when you started doing the video? You're trying to provide information, service, how you reach out to international, in this case, members or contacts. I'm curious on that part because I've been working in the medical industry for 10 years, most likely international. I'm working here, obviously, domestically. We have a lot of project with mammogram equipment as well. So, but just to start with the first question, what was your thoughts when you started doing your first video? Like, what was the cool,
Fear.
Yeah, besides
Ambition.
what was the first what you tried to accomplish? Because in my case, I just wanted to do something different. Been in the medical industry and obviously sales, and I was telling Dan, I want to stay away from just sell. We have this equipment, we have this, it's on sale. So I want to be part of like a solution for suppliers. In this case, because I'm selling equipment, but also expand a little bit projects like, I work international. I work in some projects in Trinidad, Puerto Rico. Now that they have the hurricane, they're having this big project for 5 years to restore everything, working with insurance company to replace the medical equipment. But in this case, I would like to have your thoughts about your first video and what was the goal to accomplish, if that is the case, your vision to do the video.
Well, that's easy. I haven't posted that many. Given I'm a regional medical director of a very large federally qualified health center where we see patients at 200 and 100% below poverty level. They're generally in the state of California, it's called Medi-Cal, and the rest of the United States is called Medicaid. Some are homeless, a lot of them are students, and we're providing care in 5 counties: optometry, dentistry, obstetrics, gynecology, psychiatry, and psychology. And I, in addition, as being a regional medical director, see patients myself from as high as the far desert in Barstow and Victorville all the way through Orange County and Anaheim. We're going to open that for medical, but now we're seeing psychiatry and psychology. So, and with all of that, in addition, I have a family of my own. We have a blended family, but daughter 24, 16, and 2 boys. They're 8 years old. So I don't have a lot of time for content, but my first video was for this. Dr. Josh Luke asked all of us to put a video together, hashtag in it together, on what is our purpose, what was our dream, why are we in our profession, what are we looking to do for the future, and how can we impact with our public, with our job, and why did we get in it. So I put that together rather quickly because, like I said, my time is limited, very limited. So I explained why I wanted to be a physician, why I went from owning my private practices, because it was a smaller group that I could work with 6,000 or 10,000 patients in the Orange County area, so I could expand it to work with very large the public as far as public health, where we work for the HRSA, the Health Resource and Service Administration, work with large population studies and show them that we can improve in any facet of a patient's life, whether they have been able to go to no education, because maybe their parents had them work in the fields from a very young age, no matter what country they came from, or whether they have, or, a student getting their master's degree and they're, away from home and they don't have a job, so they're, again, having no insurance, where we provide care to them as well. So that was the first video. I think it went okay.
Do you think more doctors should make videos or no?
Well, that's how social media is going. So LinkedIn said rather than arrange your content towards articles that are being written, you can still do that, but they wanted to see live and animated a 3D video. So persons wanted to see you live and what you're doing, almost like a news media reel. And I think that's interesting because then people feel more connected with you. Just as if, why do people want to go to the, meet a celebrity in person, like at a book signing? Because then they get to shake your hand, they feel like they got to know you.
Building the brand.
Exactly.
Pretty soon everyone's going to need a Wagoner wherever they go, right?
Well, we all do though. Why I mentioned the time where I started university was we didn't have carry the cell phone, we didn't have an internet,
right.
But now we do. So we joke about at our 20th college year reunion in 2012. We said, how did we not have these? Like, we were fine. We had payphones.
We didn't die.
Yeah, we didn't die. We used to just, leave messages like on a pinup board. Oh, we're gonna be here Friday at 10 o'clock at night. But now everyone has a cell phone. Everyone has an access to a computer. Even if you don't, you can go to the public library. So it connects all of us. And we never had this in real time, within seconds, a connection
Ever.
internationally.
It's incredible.
So now
And we got to connect. I think we are, right?
Yes.
But now you guys are not connected.
No,
You
but-
should connect.
Yeah. And what's nice is I can connect now with a top professional who's outside of my specialty, and they actually answer. And I can ask them a question that has been puzzling me about a patient, and they'll even provide me literature within 24 hours.
There you go.
We've never had that capability, so we're not only, enabling the public to see us one-on-one on the video, but then I'm able to actually put that in the video presentations and things we're lining up in the future. So again, like I said, it's the connectedness.
That's awesome.
But if you just have it on a 2D, on a paper form, or an article, it's black and
It's a little more
white.
boring.
But in a video, you're actually real life. It's more of a 3D.
Yeah, it's going to be very exciting.
So I think, as long as you keep it short, because we know the average person's not going to watch past 3 minutes. So my second video, I did get some comments.
Good
The
one?
Oh, they were all good.
Oh.
They like my dress, but it was.
I like your shoes.
Oh, okay. I'm the shoe person. Shoes.
You gotta show the
okay.
shoes. So hopefully you're
why?
getting that.
Why am I a shoe person?
That's your thing.
Well, yes, but doctors were very boring because we don't want our dress. Because dress is a cultural thing, as you know. Every culture has a certain dress.
Yeah, where's your white lab coat?
Well, I'm not at the office today,
Yeah,
but
right.
I have. This is an outfit I would wear to the
Oh,
office,
okay.
and as you notice, I am basically clothed head to toe, because we don't want our patients focusing on our dress. So we do, believe it or not, new medical schools have a dress code, and your residency do as well. And a lot of times, even when I was in charge of the students and medical students, and for example, University of California, Irvine would send their second-year students or their MD, PhD students to my offices in Newport Beach. A couple of times I sent their students home. I said, are you going to the beach? Are you going to a backyard horror boat barbecue? But normally, like I said, they were very respectful and they always wear their dress code. And women, we slide a little bit because of the fact that men have the standard collared shirt and slacks. You normally wouldn't see them wearing a kilt or a skirt, at least in America. Women, we have a long array of different clothes to wear, but there was that dress code in medical school and residency. So I'm again wearing pants or knee-length dresses and skirts. So I can't really have much fashion sense in the long white coat.
That's why the shoes.
So that's why the shoes.
But social media, like the guy said earlier, everyone needs something. He had an orange band. I don't have anything, but it made me think, maybe I should get something. You got the shoes. Social media is exciting. We're going to talk off camera about a lot of things going on, since I can't really mention it yet, but it's coming. But if Dr. Alexander can do it, and she's a busy doctor, regional director, I know a lot of my doctor clients, my physician clients can create content too, even if it's once a week, once every 2 weeks. Do something, get on LinkedIn, connect with people like Dr. Brooke. Where can people find you?
On LinkedIn,
Dr. Brooke Alexander.
Dio.
Okay. And Raul Gonzalez.
Raul Gonzalez.
And thank you everyone for watching. I appreciate your time, both of you. And we'll talk soon. Bye-bye.
Thank you.
Yeah.